I love genioplasties. Genioplasties, the advancement of the chin through what I would call osteotomies or cuts through the bone, sounds like a big operation, but it really is a rhinoplasty of the chin. It makes a major impact in a patient's profile, and we as plastic surgeons don't talk about sliding genioplasties too often, but it's one of my favorite procedures to perform because it makes a major change. The question would be, why not just a chin implant? Well, a genioplasty brings the lower chin segment forward, particularly in patients who have weaker chins, but it also deepens the neck because all the muscles that attach to the chin are still attached. So patients who have a real weak chin tend to have a very shallow neck. You can put an implant in, either through the mouth or underneath the chin, to help bring the surface of the chin forward, but you're not doing anything to the muscles. And over time, that patient still has a very weak neck. The beauty of a genioplasty is it's done one time, it's forever. It improves the profile, it improves the neck, and it improves your chin. And you can even have the ability to lengthen the chin in a short chin or to keep it about the same. I can't tell you the number of patients who come to see me for rhinoplasty whose noses are actually quite proportional, but their chins are too small. And so either in combination with a rhinoplasty or on its own, it's a very powerful procedure. It entails some experience to do, but I was trained and love to do genioplasties and think it's very important for patients to know that it exists and it's a great procedure. Chin implants, while very effective for the patient with mild chin weakness or an older patient who doesn't want to go through an operation like that, are okay, but in the long term, they can move, they can have an impact on the bone that they're lying on. So I'm much more a fan of a genioplasty. If a patient wants a more minimally invasive chin advancement, we actually can use structural fat or some of the more robust fillers to make a nice difference. And I'd way rather do that than a chin implant. So in my hands, you're either a sliding, advancing genioplasty candidate or you're some sort of filler candidate. And both meet the needs of patients depending on their anatomy and their goals.